Welcome to the Intimate Marriage Podcast, where I teach educated, successful couples how to have incredible, passionate relationships so that you can stop compromising and start feeling fully alive in your relationship. I'm Alexandra Stockwell, aka the Intimacy Doctor. I'm a physician, a relationship and intimacy coach, and I'm an intimate marriage expert. My husband and I have been married for 26 years. We have 4 children and full professional lives, and we've created an amazing marriage. I've shown hundreds of couples how to do so as well. So if you want to deepen your understanding of your own relationship and learn to access new heights of emotional, sensual, and erotic intimacy, you're in the right place. I will show you how. Now, let's dive in. I'm really glad to welcome Dr. Tiff Cagle to the podcast today. She is a board-certified family medicine physician, sex educator, and coach from Durham, North Carolina. She chose to specialize in family medicine because of her desire to provide care through the lens of each person's mind, body, relationships, and community. And after years of traditional medical practice, she is delighted to bring this holistic approach to her work in sexual health. She received her medical degree from the University of North Carolina at Chapel Hill School of Medicine, where she first discovered her passion for decreasing stigma around sex while providing HIV testing and counseling. She went on to complete her residency training at Duke University Hospital and now holds a consulting position in Duke's Department of Community and Family Medicine, providing resident lectures and mentorship. And let me just say how much I would have loved to have had you as one of my mentors while I was a family medicine resident.
It's definitely, mentorship cannot be overstated in terms of its importance. And I think a lot of us look back and wish that we had had more guidance. So it's something I really enjoy providing.
Yeah. And even to know what questions to ask. One of the ways to learn that is by having a mentor point out things that I might not have had my attention on, which I'm guessing you do based on how holistically oriented you are. Do you actually, in speaking with residents, make a point of asking about sexual health even when they haven't brought that up when they're reporting to you about a patient?
In a mentorship context, I typically wouldn't bring it up unless it's something that they offer just for wanting to respect their comfort level. But I do agree it has come up. Relationships are tested in many ways, particularly during medical training and other stressful employment situations. So it can be really crucial to address that.
I see what you're saying. That's great. And when there's a misunderstanding, I always get excited because then I learn something, which happened just now, because I wasn't actually asking about you talking about the resident's own personal sexual health. I was thinking more that, I don't know in what context you mentor. I was thinking that if you're at the clinic, like I was remembering in my first months of internship, after every single patient, I would go and find one of the attendings and describe what the patient came in for, what they said, what I was thinking, what my exam showed. And are you doing any of that kind of clinical mentorship?
No, I'm not precepting. This is just regarding how residents are handling their training, how they're balancing work and personal life. So it's much more focused on their personal experience rather than their clinical care.
Okay, well then I think that's appropriate, of course, that you're not just randomly asking them about their sex life. That is not the way to keep your position and be able to do the good work that you do. But
Right.
Since you are so attuned to being respectful in that way, was it in any way complicated for you to evolve out of clinical medicine into the realm of sexual health and talking with clients about sexuality? Was that a complicated pivot for you? It definitely was for me.
Yes, it has been an adjustment. I think that I'm much more mindful of how I choose my words now, and I to go back to what I was saying earlier with regard to when and how I bring up sexual health, I do really want to respect someone's comfort level. So I try to present things in as respectful a way as possible and let someone else kind of show me their comfort level in terms of how far we go with the conversation. So,
and what kinds of things does someone seek you out for? Now, I'm not talking about mentorship or where there's another kind of context for the interaction, but if somebody wants your services, I know you're getting your the coaching part of your business is relatively newly begun, but let's say I know somebody in the Durham, North Carolina area, or I know you're doing this virtually, but anyway, and I want to refer to you. Who's a good person to seek you out at this point? Whom do you welcome?
yeah, I am open to talking about any and all sexual concerns. I do offer a brief free consultation if folks are curious whether their concern is something that I feel comfortable coaching around or offering a medical consultation for. I would say the areas of focus that I see the most are sexual concerns like erectile dysfunction, premature ejaculation, orgasm difficulties, desire discrepancies, and then I have a particular area of interest in living with sexually transmitted infections. Because I'm virtual, I don't do diagnosis of new symptoms of sexually transmitted infections, but for someone who has an STI that they're trying to figure out how to manage and navigate, I love to provide coaching and guidance around that.
Okay. That was just a cornucopia, a magnificent buffet of things I want to ask about. And I'm going to ask two questions. Let's talk about herpes. Herpes is so common. It has such stigma. Let's just say I'm a sexually active, non-partnered 27-year-old woman, and I have herpes. What guidance do you have for me as I date and interact with people? Actually, that's a question that I'm curious about because that's a question I get a lot. But really, to make it more relevant, let's just put it in the context of a 10-year committed relationship. One person has herpes, the other doesn't. How would you recommend navigating that?
Yeah, I love this question. And these are the exact kinds of things that come up so often. And there's not many spaces to discuss it in a safe way. So I really enjoy being able to hold space for this. So I would say, first of all, we would want to know the type of herpes, as you know. But for your audience, I'll explain there is herpes type 1 and herpes type 2. Type 2 is typically a genital infection, whereas type 1 can be oral or genital. We do see more frequent type 1 infections genitally. Both of these strains are very common in the population. So over half of our adult population has herpes type 1, even if they're asymptomatic.
Someone could have it without knowing it.
Exactly, yes. Most infections of herpes are asymptomatic. And then, but HSV type 2 or herpes type 2 is also very common. 12% of the population, or 1 in 8 people, have herpes type 2. In terms of a committed relationship, there are some steps that you can take. Most people will have symptoms around the time that they're about to get a recurrence, whether that's itching or tingling or shooting pain down the leg. So being aware of your symptoms and avoiding sexual activity during those times can really help decrease your risk of transmitting it to your partner. The other thing I would say is taking a medication to suppress the viral activity like valacyclovir is something you can take daily. And you would probably want to have your partner tested for herpes type 1 and 2 antibodies to see whether it's necessary to take a daily medication to reduce the risk of transmission. It's not 100%, but it is a very helpful step if you're trying to be as cautious as possible.
Because if your partner already has it, it's no big deal, then no protection is necessary.
Exactly.
Okay. Thank you. That is such a prevalent question, actually, like a prevalent situation, as the numbers you've shared indicate. And I'd like to pivot to something else you said, because I'm actually very familiar with ways of treating premature ejaculation that involve breath and tantra practices and things along those lines. And I actually don't know what the latest is when it comes to medical advice on that. And I'd love to hear. I know you do it as a coach, but what approach do you take?
Yeah, so medically, I would say most commonly the medications that would be used if someone has premature ejaculation that has been kind of resistant to typical behavioral measures that we would try to implement first.
Yeah, what behavioral measures would you use? It's just a topic I haven't talked about on the podcast before, so let's go into it.
So I love the start-stop method. This is something used for both erectile dysfunction and premature ejaculation. The modification's a little bit different for ED, so I won't get into that. Try to stay focused and be on topic. But for premature ejaculation, what you want to do is think of your arousal on a scale of 0 to 10. And as you're having intercourse, you want to maintain your arousal between a 3 and a 7. So often what folks with premature ejaculation are doing is trying to distract themselves and to be anywhere but in their body. The problem with that is you lose the connection to the sensations you're actually having, and you can reach that point of orgasmic inevitability before you realize it. The point of paying attention to your arousal is that once you reach a 7, the movement needs to slow down. You need to take a break, pause, engage in touching, do something else. Then once you're at a 3, you can resume. Doing that over time will allow you to be more in touch with your sensations so that you can increase your awareness. Quickly though, sensate focus, which is what I think we'll talk about today, is the other thing I would recommend, but I'll save for going more in detail for whenever we're ready to start that conversation.
That's so perfect because we had planned to do that. So that will be useful for that. And I guess before we go into it, I want to say, I don't know if this has been your experience as well, but there are couples who are in committed relationships having sex, and she might think it's premature ejaculation and he doesn't. I don't know why, if that's because porn or who knows what the situation is. But I guess what I want to say is that if you're listening and this is relevant for you, whether you're a man or a woman having heteronormative sex or otherwise, I guess if you're two lesbians, what I'm going to say doesn't apply, but any other combination, that it's worthwhile in as open-ended, curious, and respectful manner as you can to have a conversation. Don't assume that because you think things are that ejaculation is happening prematurely, that's what your partner also thinks. Sometimes there's no question, but there's an area where a man lasts longer than a very little while, but not as long as his partner would like. And whether or not that meets the technical definition of premature ejaculation or not is really irrelevant. What matters is that a conversation would be very helpful, and so would what Dr. Tiff has just described. And doing that is the sort of thing that you want to have a conversation about it ahead of time. Because if you just start doing it, it can be very confusing to your partner if they don't realize you're being intentional as opposed to like negligent. So the conversation is so important. Did you want to add something to that?
Yes, absolutely. I think that our expectations and perceptions are the most important thing outside of any sort of objective assessment of what's going on. So it's really important to understand. And premature ejaculation in particular can have, it's so relationally specific. So did that develop out of this person having a partner who had pain with intercourse, and was premature ejaculation sort of an adaptive response to try to prioritize one's
Prevent harm?
Yes.
Yeah.
So yeah, but also I think the increasing access to porn online is certainly changing everyone's expectations about what sex should look like. So being clear about what it is that you want out of a sexual interaction can help someone accommodate that in a way that is consistent with their body's capabilities.
Yeah, and actually for the kind of conversation we're talking about right now, you don't even have to use the premature ejaculation, because um that can cause shame. There's a way to just say, hey, I was listening to this podcast and I think we might be able to have more fun and then try this. I mean, there are a lot of ways to introduce it, but okay, let's transition. When you and I first spoke about having this conversation for the podcast, you told me about one of your practices, and I thought it would be really lovely for you to guide us through it during this conversation. I guess my very first question is this something safe to do while driving? Because I know a lot of you listeners are commuting to work or from work, and I just want to be super clear if this is a highway activity or not so much.
No, definitely not something you want to be doing while going down the road. It's a mindfulness touch activity. So I'll explain more about the set and setting, but definitely something you want to be intentional about.
Okay, so what is the context in which you might guide a client through this process? It sounds like it's helpful if someone's experiencing premature ejaculation, but what other context? And what I'm really asking is, while you're there listening, I want you to know if this would be helpful to you.
Yeah. So I would say we particularly target this exercise towards folks who have a specific sexual concern like premature ejaculation, erectile dysfunction, orgasm difficulties, desire discrepancies, but also body image concerns. Regardless, I think a lot of couples would benefit from introducing this just to reframe our approach to intimacy. Going back to what we were saying about expectations and performance anxiety, this exercise seeks to kind of rewire that goal-oriented focus towards sex and to make you more mindful and allow you to fully immerse yourself in your sensations with your partner. So the principles are, this is a touching exercise that is based on attention to 3 different sensations: temperature, pressure, and texture. So with temperature, we're thinking, is this warm or cool to the touch? With pressure, is this firm pressure or soft pressure? And with texture, is this rough or smooth? So there's a book that gives a great overview of this exercise called Sensate Focus in Sex Therapy, the Illustrated Manual by Linda Weiner and Constance Avery Clark. And they describe 3 principles that are crucial in the completion of this exercise. The first being touch for yourself, not for your partner. Touch for your own interest rather than for arousal or pleasure. And lastly, manage your distractions by returning your attention to the 3 sensations: temperature, pressure, and texture. So I think most folks who hear this think, well, this doesn't sound like a formula for having better sex, because this sounds very self-absorbed. You're touching for yourself, you're not touching for arousal. But the irony is that when we're trying to force something, it's like if you've ever tried to force yourself to go to sleep when you can't, you can see that trying to make a particular outcome happen is actually pretty ineffective. So the goal with this is to bring an attitude of curiosity and exploration, kind of similar to, it's a bit of taking you back to when sex was a newer concept to you and everything was new and exciting and you didn't jump straight to kind of an outcome-oriented activity. You took your time getting to know your partner. And that's what this exercise seems to, or seeks to, bring out.
Okay, so just to clarify, this is a partnered exercise. You would do it with your person.
You can do the activity on your own, but the way that I usually describe it does involve a couple, yes.
We're not going to demonstrate this now, but I want to know, like, if I'm going to go do this with my husband this afternoon, are we both naked? Like how do we proceed?
Yes. So to kind of set the scene for you, Another thing that surprises people about this exercise is that it is not intended to be romantic. So you want to have some protected time, about half an hour. You'll want to manage distractions, so get pets out of the room, lock your door if there are kids or other family members in your house, and you want to pick a time when you're not too tired. You want to have enough energy to be fully present. But what I was saying about this is not a romantic activity. It is recommended that you be fully naked or naked to your level of comfort. And the important thing is you're undressing yourself. We're trying to avoid anything that's associated with sex is about to happen. We're removing pressure and expectations. So you would undress yourself. You'll have some soft lighting in the bedroom. We don't want candles or music because that tends to get people thinking that sex is about to happen. And then you can lie on the bed together or get in another comfortable position, maybe one partner against the head of the bed with the other partner sitting back in their lap.
Okay, sitting back in their lap on the partner? I mean, sitting in one another's, one partner's in the other one's lap?
Yes, leaning back with their back against the partner's chest.
Okay. So both facing in the same direction.
Yes.
Kind of the way that I picture a boyfriend and girlfriend at a high school football game where he's on the stands and she's one level lower with leaning back against his chest.
Exactly.
That position, but
yes.
on the bed.
Yes.
Okay.
So the person who, if you're doing that position, the person who is against the headboard of the bed would be touching first. The first few phases involve taking turns touching each other. So you want to remember the principles that I mentioned earlier. You're touching this entire time with attention to temperature, pressure, and texture. And if you start thinking about anything else, bring your attention back to that. It's also important to remember that this is not meant to be a massage. This is not meant to be pleasurable. You're touching for your own interest and curiosity. So the person who goes first, in the first phase, there's a total of 6 phases that I teach. In the first phase, chest and genitals are off limits. So this is just an exploration of all the parts of the body.
Although genitals are being contacted because of the posture, but just not with the hands.
Exactly. Yes. You're touching with your hands only for this part of the exercise.
Yeah.
So that would be phase 1. You're wanting to keep conversation to a minimum once the exercise starts. It's meant to be very quiet, slow, and mindful. Once the first person who's touching has decided that they've had enough, or if the person who's being touched decides that they're ready to do the touching, say something like switch, and switch into a different position and take turns and repeat the process. If the person who's being touched finds anything uncomfortable, whether it's an area of the body that's anxiety-provoking, or it's ticklish, or they just don't enjoy it, you can do something called handwriting, which is where the person who's being touched places their hand over or under the toucher's hand and gently guides them to a different area and then lets them resume touching on their own. And that's really important because it not only provides safety for the person who's being touched, that they can stop whatever they need to stop at any time, but it allows the toucher to touch with confidence, knowing that if there's anything that their partner doesn't like, they'll let them know. So you're building these important nonverbal communication skills through this exercise.
Okay. And I don't want to have too many details that it's too hard to keep it straight. I feel like we need a handout, but with the 6 phases, other than adding in chest and genitals, are there other elements that would be introduced?
Yes, so I'll give just a brief overview of those. And I do have a blog post that goes over Sensate Focus in detail on my website if you want to put that in the show notes or direct folks to that.
Oh, yeah, we'll definitely put that in the show notes. Then I feel more comfortable proceeding. I just don't want to leave someone with like this delicious exercise and all this instructions, but it's hard to organize it enough to follow it. Or if one person is listening, like to describe it to their partner. So we'll definitely include that link in the show notes.
Yes, it gets really tedious to describe it, but
it doesn't sound tedious to do, that's for sure.
Well, just to give a broad overview of the subsequent phases. So you mentioned adding chest and genitals on limits. Then there's the introduction of mutual touching, where you're touching at the same time, and it starts to look more like an actual intimate encounter where it's not so regimented and taking turns. You can add something called positive handwriting, where the person who's being touched can actually direct the toucher's hand to an area of interest rather than just directing away from discomfort. And then the last three phases involve genital contact. Briefly, the first phase being genital contact with no penetration, and then the second two phases involve penetration if that's something that is part of the couple's sexual repertoire.
Okay, you know what I really like about this is that a lot of the time in the context of communication, I'm directing couples back to very basic, open ended questions, like asking things that they might have asked when they were dating, but haven't asked sometimes in 15 years. Like, what was the best part of last week for you? What are you finding most challenging at work these days? Maybe you know if it's something your partner just tends to share a lot, but maybe you don't know because you're focused on all the other things in daily life and you feel like you already know one another. So you don't have these questions. So the point is that it can feel really basic, but it always opens things up in sort of mysterious, wonderful ways to just slow down and cultivate curiosity, ask open ended questions in this way. And I feel like the exercise you've just described is the exact same thing in the realm of touch, where you take it back to the basics and really pay attention to your own experience and your partner's experience through trusting that they'll guide you differently, that you, as the receiver, honor your own experience such that you learn things about your partner by how they touch for their pleasure, and also make sure you honor your own. You don't just brace through something if it's uncomfortable, you move their hand. And in kind of going back to those basic building blocks, something new and so much better can be built. That's how I'm hearing the exercise without getting caught in the specific instructional details, although I'm sure that they are very important to creating exactly what I've just articulated.
Mm-hmm. Yeah, I think taking certain things off the table and getting back in touch with just basic touch does really open up that opportunity to reconnect with these things that so often get glossed over when we're going straight towards sex with a particular outcome in mind. So I do really love that and as each phase progresses, you're encouraged to continue the skills from the previous phase. Just because genital contact is involved, don't go straight to that. Continue the other skills that you've built as you've gone along.
And so, would you say this is something to have as part of the sexual menu? Hey, are you in the mood to do sensate focus today? Or is it the sort of thing that a couple, if they're feeling challenged with having great sex, would do every time that they're intimate together until they graduate themselves,
Yeah,
essentially?
typically you would perform this more as a graduated exercise, and we do try to keep it separate from sex itself because we don't want there to be the pressure and expectations around the exercise that some couples or partners feel towards sex. So the idea is that you're removing all of those shoulds and expectations and just being present with each other and exploring and building eroticism. So you would do most phases a couple of times and then move on to the next phase. And certainly arousal can happen during the exercise, and you're encouraged to notice that and then kind of move on and direct away from that. That isn't really supposed to be the focus of sensate focus.
Okay, well, I definitely see why you called it a mindfulness sexual practice. I don't know if you said sexual, but definitely a mindfulness practice. It's really great. And you have such a nice balance between like clinical but warm and inviting also. That's a lovely way of expressing respect. And in a not so gracious pivot, I'd like to turn the conversation, and anyone who listens to the podcast knows how deeply I believe that intimate relationships are the ultimate vehicle for personal growth. And so, having heard the way that you teach this in a measured, really inviting fashion, like it doesn't sound seductive, it sounds so foundational and deep, such that then seductive activities will become more pleasurable. What have you learned about yourself in the context of being in a relationship?
That's a great question. I think for me, my biggest growth edge has been learning how to be vulnerable. I think historically, I have tended to jump to kind of more secondary emotions like anger, for example, rather than getting in touch with how do I feel exposed in this moment? How do I feel hurt? How do I feel threatened? And being willing to express that and trust someone to make space to hear those vulnerabilities has been the most rewarding thing for me about being in a relationship.
I'm smiling over here because I feel like your answer is that you've learned to do the equivalent of the sensate focus in intimate partnership. And it's beautiful to hear that. All right. Well, we know that the show notes will include a blog with details about how to do this exercise with your partner. Is there anything else that you want to share in our conversation today?
No, I just want to thank you so much for having me on here, and thank you, as I've said before, your advice is so invaluable. So I appreciate you creating the space for folks to learn and share.
Well, my pleasure. I'm really happy to get to know you and for everyone listening to as well.
Thank you so much.